unfortunately, I don't know why. Anyway, the first slide is I'm going to talk today about healthcare as a public good. And my name is Dr. Walter Tsu. I right now I'm with a lot of different nonprofit groups, and I'm working with Physicians for Social Responsibility. But I'm speaking really more today on as a national board advisor to Physicians for a National Health Program, and really to talk more about why healthcare, I think, should be a public good. And I'll start by saying I have no financial conflicts of interest to disclose. So I'd like to start my talk today by asking two simple questions. And I was wondering if people could put their answers in the chat. And the questions I have is, first, what is the health policy of the United States of America? And the second question is, how much in dollars will we spend, let's say in this past year, 2020, on healthcare? So the two questions are, what is the health policy of the United States of America? Put that in the chat. And then how much in dollar amounts will we spend this, and how much dollars did we spend in 2020 on healthcare? So I'm happy to hear what your answers are. Now, for whatever reasons, I cannot see the chat. Anyway, maybe some of you could say it out loud since we're a small group. If any of you have any thoughts about the answers to those two questions. And since I can't read the chat.
There's nothing in the chat yet.
There's nothing in the chat?
No.
Oh. So does anyone want to try to answer those questions?
Somebody did just respond in the chat.
Yeah,
What-
health policies employer provided, is able to self-provided, spending is likely in the billions.
Okay. So health policy is employer provided, and then we're going to spend billions of dollars on healthcare.
Yep. And our
Any other thoughts?
programs for those that are qualified, it's difficult.
Okay. Well, and how much does that person think we're going to spend on healthcare in 2020? How much did we spend in dollars, do you think? Anyone? Billions. Well, I won't belabor it, since, but I would say that if you think about those two questions, it is striking that most people never think about this question about what is the health policy of the United States. But whatever it is, we would spend billions of dollars on something that we don't even know what the health policy is. I mean, if you worked for a company and they told you, look, usually they start off, this is our mission, these are our values, this is what we stand for. But in America, we really don't know what the mission of the health system is. But whatever it is, we're going to spend billions and billions of dollars on it. And if there was ever a recipe for waste, fraud, and abuse, it's the US healthcare system. Well, the answer to the question about how much we spend, I think, should disturb all of us, because in 2020, we spent $4 trillion, not billion, trillion dollars with a T And that is astounding. There's, in fact, very, very few things that are in the trillions of dollars, but healthcare happens to be one of them. And if you think about it, if we're really going to address some of these really big, huge issues that are facing our country, like our national debt or climate change or, you know, huge infrastructure rebuilding, you're going to have to deal something with healthcare, because unless healthcare is under some type of control, um, it's hard to fathom where you're going to get the money at that scale, unless you can find it from healthcare. And if you add up over the next decade from 2020 to 2029, how much money do you think that adds up to? Anybody have any idea? Because it's a number that nobody, well, I won't belabor it. I'll just simply tell you that that number is about 51 trillion, $783 billion. Think about that. $51 trillion over the next decade. That is so much money that you just have to ask yourself, where are you going to get all that money? But that, in fact, is how much we're going to be spending on healthcare. And it virtually everything else in our society pales in comparison to how much we spend on the healthcare system. And if you think about the fact that we don't have an idea what the health policy is that controls that $51 trillion, wow, there's somebody who's really happy about the fact that we don't really understand healthcare, because they get to control that money and they make tons and tons of money out of this system. So who controls our healthcare dollars is a very important question. And I'll give you a big hint. It's not you and it's not me. It's somebody else out there who gets to control it. Usually people in the medical industrial complex get to control it. And you might say, well, if we spend that kind of money, if we get something for it, then you might say that was really good. But in fact, if you look at this graph of all these other countries versus the United States, there's one country that's a huge cost outlier, and that's us. The United States spends so much more than all the other countries together. And let's suppose we spent all that money, but we got to live 2 or 3 years better. We would say, well, maybe it's worth it because we get to live longer. But here's exactly the irony. We not only spend more money, we get to live 2 to 4 years less than other countries. That is to say, we pay more and we get to die sooner for that privilege. And that actually, even for conservatives, if you think about it, that is not value for your money. That is a ripoff. We are totally being ripped off by the current system, who are taking gobs of money out of our paychecks to pay for a health system that actually kills us sooner than other countries. And we should be outraged, frankly. But most Americans are unaware about this. And because of that, they have not been able to address this glaring problem that we have in our healthcare system. No issue domestically is more divided than healthcare. And in part it's because the people who get to control the system like it that way, and they don't want you to think about healthcare. And in fact, and whenever you talk about healthcare reform, it becomes like a rabbit hole. So the private insurers say, well, you want to take away your insurance and we're going to take away your choice. And then you have to talk about premiums. And those who want single payer, they want Medicare for all. They want one size fits all. And then they say, oh, you're going to have to pay taxes to pay for all that. And frankly, if you start off with this debate about private insurance versus single payer, most Americans, their eyes kind of roll to the top of their head and they say, oh my God, I don't know. I don't really understand all this. And I don't understand why single payers have to pay for healthcare and not married people and other crazy stuff like that. So I want to step back a little bit and reframe the debate at a level that I think more people can intuitively understand. And that question is whether healthcare is a public good or it's a market commodity. And if you heard Sarah Nelson speak this afternoon, you'd really hear her really talk a little bit more about this issue, about whether healthcare is a public good or a market commodity. And she was very strong about saying how important it is to see healthcare as a public good. Do we think that government's the answer, or do you think government's the problem? Do you think private insurance can't be trusted, or do you think private insurance works well, whatever that means, for 176 million Americans? And to complicate things more, healthcare in the English language has dual meaning. It can mean both the financing and the delivery of healthcare. If this is Chinese, for example, we'd actually have two different characters and two different pronunciations for this concept of healthcare financing or healthcare delivery. But this is English, and we can use it in the same sentence, like people like their healthcare from Blue Cross Blue Shield, implying that they like their insurance company. Or you could say people like their healthcare from a patient, referring to the fact that they like their doctor or their nurse or their hospital that took care of them. But in fact, those concepts of healthcare have been conflated so that some people get confused about financing, some get confused about delivery, and the insurance industry takes advantage of that. So for example, here's the Partnership for America's Healthcare Future. And they say in their ads, Americans don't want a one-size-fits-all government health insurance system. But instead of showing people behind a computer monitor with their headsets on and deciding whether they're going to accept or deny these claims, they show instead a cute little girl with a teddy bear in a hospital bed, implying, of course, that it's their insurance industry, is responsible for the excellent care that this young girl with a teddy bear got, when we all know it's really the nurses who did all that work. And it's another example of how the country is totally confused about healthcare and how we are being deceived or fraudulently about how much we spend on healthcare and how we have given credit to the insurance companies when it's actually the delivery system that should be getting the credit. So which road should we be taking here? If we think healthcare is a commodity, then obviously, if you don't have any money, you don't get any insurance. You don't get any coverage. And in fact, if it's a market commodity, you would do what the Affordable Care Act, you would require people to purchase only private insurance. It's the only option you have. There is no what they call public option. That is to say, under the Affordable Care Act marketplace, you can only purchase private health insurance as your only choices. And of course, that's a good deal for the shareholders. The shareholders then can profit from the insurance that's sold, and they then control both the insurance and also the for-profit hospitals where the deliveries happens. And of course, under a market system, you would start rating your doctors and hospitals. You would force consumers, we used to call them patients, but consumers, to have high copays and deductibles so that we have consumer-oriented healthcare. And so you can have some skin in the game. And if we have, let's say, NIH money under a market system, we would actually fund all this research and then give the patents away to for-profit drug companies so that they can actually take all the generosity of our research and give it to these for-profit companies so they can make billions and billions of dollars. Now, you might think that's crazy, but in fact, that is exactly how we do things in America. And it's part of the reason why our healthcare systems cost so much money. Now, healthcare as a public good would look very differently. We would start with the premise that everyone's in and nobody's out. You would pay what you can afford. You don't make a lot of money, you don't pay money. If you're homeless, you don't pay anything, but you're still covered. But if you're very, very wealthy, you pay a lot more than what you would currently pay now. The delivery system is not owned by shareholders. The delivery system is only responsible for providing care to the patients. And that doctors and hospitals and nurses would actually be rewarded based on the improvement of the patient. There would be no financial barriers to care. There's no co-pays or deductibles. You get sick, you come in, and we take care of you. And our NIH research would then be funding basic biology and treatments, and it's not going to be giving our patents away to for-profit companies. This concept of public goods is not actually that foreign a concept. In fact, if you think about it, we're talking about a service that's provided without profit to all. It's funded by taxes. They are things that we as individuals cannot afford by ourselves. But collectively, through our tax dollars, we can actually afford something that is universally shared and beneficial for our society. So, for example, our hospitals receive our public goods. So are our schools, our wastewater treatment plants, our public health systems, our firehouses, and even for the conservatives, our national defense. We don't, that our national defense is funded by tax dollars. We don't consider that socialized national defense. We can consider that actually something that's a public good that all of us benefit from, since most of us cannot afford our own ballistic missiles in our backyards. So public goods are it's a concept that we understand. We all collectively benefit from, and it's funded through tax dollars. And that actually gives us a hint as to how we would finance, let's say, our healthcare system if it's a public good. So how do we pay for healthcare? Well, under a market system, you pay through health insurance premiums. There's sort of a fixed price you pay, and then you vary the co-pays and deductibles. Whereas if it's on a public good, it would be based on your ability to pay, largely through income taxes. You don't make a lot of money, you don't have to pay a lot of money. And if we were to actually think about how we do healthcare financing, under a market-based system, which we have now, our wages are constantly stagnant. They're due to the high cost, the hidden cost of health insurance. So when you go to the bargaining table, you bargain largely around wages and benefits. And the health benefit is the big enchilada. And you might be able to get better health benefits, but you know what? Your employer is going to take it out of your wages, which is why wages have stagnated for the last 3 decades in America. The employers buy higher deductible health plans to afford these health insurance plans that they negotiated. And increasingly, the insurance companies are offering skimpier and skimpier plans for the employees, because that essentially is the only thing that the employers can afford anymore. That's in contrast to healthcare as a public good, where we could actually tell employers, if you stop paying your health insurance premiums, let's say $10,000 you pay for a family plan, you could give that as a salary increase to your employees. That would be much preferable. And we're talking thousands and thousands of dollars that employers spend for health insurance premiums that could actually be given in salary increases to employees. And then you as an employee, yes, you would be responsible for paying the higher taxes maybe, but it's not going to be $10,000 for higher taxes. It'll be several $100s maybe, or maybe even $1,000 more. But collectively, because we all chip our tax dollars together, we get much better bang for our buck, which is something that we should learn from rather than pay for all these health insurance premiums. Consider this. This is what our current way of paying for health insurance now. We pay a fixed price health insurance premiums, regardless of your income. Well, if you make like $10,000 a year, $40,000 a year, that's like 30% of your income right there just to pay for your health insurance for you or your family. That's in contrast to maybe if you made $400,000 a year, where it would only be 1% of your income. And so who likes the system we have now? Well, if you're very rich, you love the system you have now because you only have to pay maybe 1% of your income if you're very, very wealthy. And who hates the current system right now and finds it unaffordable? It's people who basically are in the margin, who are in the lower echelon of our income scale, because you're talking about something that could be 30 to 40% of all the earnings you make having to go just to health insurance. And that's not tenable. Even if you use the Trump's tax brackets, it would be much more progressive. So that even at the top tax bracket of 37% would be far preferable than paying only 1% of your income toward health insurance. What we really should have is a revision of how we look at the curve on paying for health insurance, so that maybe the more you make, proportionally, the more you pay for your health insurance. And if you really wanted to be correct, I prefer something like a progressive funding mechanism, where if you make, let's say, a lower income or middle class income salary, you don't pay a whole lot of money toward your health insurance. But as you get very, very wealthy, you would actually pay a bigger chunk of your income. But let's say you made $600,000 a year, and even if you paid $200,000 toward health insurance premiums, you still walk off with $400,000, which is more than enough money to live on, frankly. So the truth is that a more progressive way of funding would be preferable. In fact, what we do right now is exactly the opposite. Look at these two curves. The current curve right now is exactly screwing the poor and middle class in this country, because it takes such a huge chunk out of your wages to pay for health insurance. As opposed to if we use progressive financing, we could actually make healthcare much more affordable. So when people say, how much would Medicare for all cost? The answer is it depends on how much you make. Because if you're in the lower and middle class income and we use progressive financing, you wouldn't have to pay a whole lot of money to get health benefits. But if you made a huge amount of money, like your hospital CEO does, you will pay a bigger chunk of your income toward health insurance premiums than you currently do now. And you might ask, well, why would a rich person want to fund healthcare? Well, here's a story. I mean, one summer when you were in high school, you worked at McDonald's in Miami. And what did you learn about customer service? Well, this young man says, I learned that it was really hard. I was a cook. They wouldn't let me anywhere near the customers. This was my acne teenager stage. They were like, why don't you work in the back? That person, that young teenage acne kid, was Jeff Bezos. And when Jeff Bezos worked at McDonald's in Miami and not making a whole lot of money, the same healthcare system would have funded him. And it would be based on his ability to pay. And now that he has a lot more ability to pay, yes, he can pay a lot more money toward health insurance for this country. But if healthcare is a public good, just in the same way that we benefit, the rich pay more, yes, and the poor pay much less. It's based on your ability, on what you can afford. There is a bill out there that actually is proposing something similar to this, although the financing mechanism has not been written in stone yet. But HR 1976, which is Medicare for All Act of 2021, prime sponsors is Pramila Jayapal from Seattle, Washington, and Debbie Dingle from Detroit, Michigan, has 114 co-sponsors, including 14 House committee chairs, and 2 out of the 4 Democratic leaders support this bill. That's pretty impressive, I think. Well, what would have meant had we had Medicare for all facing this COVID pandemic that we have? Well, consider this, that if it's a market commodity, you could conceivably charge anything you want for the getting the test, for your hospitalizations in the intensive care unit, for the vaccine. I mean, there were people when the vaccine first came out who paid hundreds of dollars, jumped the line so that they can get the vaccine. That's what a market commodity does with things like our healthcare system and our informatics system. Well, the real problem is that when you get your test done or your vaccine done, who knows that information? That information goes back to your private insurance companies who may or may not share that information. The data itself is all fragmented. And you have data collected by one hospital system that doesn't even talk to the other hospital system. So we have this chaotic, fragmented, uncoordinated way of approaching COVID-19. That's in contrast to if healthcare was a public good, where the testing, the hospitalizations, and the vaccine is free. Because in a pandemic, you want you want to encourage all this. And if you want to have an idea what it would be like to get a Medicare for all type system, think about the vaccine program, maybe right now, where there's plenty of availability of the vaccine. You can go into any of the vaccine sites and get the vaccine, and you don't even have to show proof of payment. You just get it done. And that's the experience of almost everyone in other countries that have some type of national health insurance system. And then we can actually have a national electronic medical record where we could capture all the test results. We could have seen which treatments were actually effective in COVID-19. We could have actually seen who was admitted, what treatments they received, and we could have actually quickly identified the most effective therapies, not hydroxychloroquine like we did in the beginning, but actually we would have found much more effective treatments. Maybe we would have found dexamethasone's was much more effective at an earlier stage. And we would also know who's vaccinated, so that, this concept right now about whether we should let people get on cruise ships or airplanes, we would like to know if they've been vaccinated and encourage them. But we can't capture that right now because that information is all proprietary, held in the hands of private insurance companies, which is, if you think about it, illogical if you want to try to fight a pandemic. The implications for COVID-19 are also profound in terms of a market commodity, because we saw that if you lost your job, you lost your health insurance. Can you imagine a worse system you can come up with at the very moment that you need health insurance? You lose your job, you're laid off, and now you lose your health insurance. And you're very much on your own. In fact, we have like Medicare, Medicaid, the VA, and we have GoFundMe. We are unique in the world because we have this GoFundMe effort to try to pay for the medical bills for people who don't have any type of health insurance. And in fact, 1/3 of the GoFundMe site are people who just simply got sick in America and have no way of paying for it. That's pathetic in my mind. That should be a national embarrassment that we would actually impoverish people, force them to go to GoFundMe simply because they got sick in America. That's in contrast to if healthcare was a public good, because if you lost your job, you're still covered. That I am my brother's keeper, and that actually represents real security. We live in a country now that have live free and die, not live free or die. We live free and we don't wear masks and we go out and think we can do anything we want. And in the midst of a pandemic, guess what? 567,000 people paid the ultimate price of that. We killed literally all these people, more than 500,000 people in this country, because we did not actually have a coordinated approach to fighting a viral pandemic like COVID. And we should be embarrassed that we as a nation, with all the technology, all our vaunted healthcare system, et cetera, that so many people have died. A disease that was literally unheard of in 2020 in 2019 becomes the third leading cause of death in 2020 overnight, literally. And it's still going on. And in Pennsylvania, we still have lots of people who are dying of COVID. So this is a serious problem that we have in this country. And it's not just, individuals out there. It's killed like over probably 3,000 healthcare workers or more. And you would think that the government would want to track this, but we don't even track it as a country, that how many healthcare workers die, which is an embarrassment. Many, many nurses have been at the front lines on this issue and have passed away because they were simply doing their job and not getting the adequate PPE they needed to do their job correctly. Right now, 2 weeks ago, this headline was in the Washington Post. Biden faces pressure from Pelosi and Sanders over whether to double down on Obamacare, or the Affordable Care Act, or to expand Medicare, maybe down to age 50 or 55 or something. And which way we go actually goes to the heart, in many ways, if you think about it, of what I've been talking about. Because how we go at this juncture, how Biden goes, will say a lot about which way we think healthcare should be directed in this nation. So should it be the Affordable Care Act or Medicare for all? Under the Affordable Care Act, whether we realize it or not, it is not socialized medicine. The Affordable Care Act is very much a market-based approach to healthcare. It is dependent upon private health insurance. It is requirement under the Affordable Care Act that you buy private health insurance in the marketplace. And just to show you how ridiculous it is, with all the increased cases of COVID in the country, you would think that it would be a disaster for the private insurance companies. But in fact, if you look at this graph, the insurance companies have had record profits this year in 2020, more than they've ever had before, because they don't have to pay for any of the elective surgeries anymore, elective procedures, and because people stayed home and they still had to pay their health insurance premiums. So they collected gobs and gobs of billions and billions of dollars in health insurance premiums and paid out pittance. And that which they had to pay for COVID, well, the federal government basically borrowed, you and I as taxpayers borrowed billions and billions of dollars to bail out for COVID. So the hospitals actually got money for COVID treatments that were paid for by the federal government and not by the private insurance companies. It was kind of a scam that they get to keep all that money for themselves. That's in contrast to whether healthcare is a public good, where the savings could have been redirected to buy purchase PPE or to pay for COVID treatments. And then everyone would have been covered. We wouldn't, all those record profits that, money that the government would have saved from not paying for elective surgeries would have been redirected to help fight the COVID pandemic. So in summary, let me say that as healthcare is a public good, the prevention itself would be free. That would be funded like other public goods, schools, hospitals, wastewater treatment plants, national defense, based on tax dollars and based on your ability to pay. We would have a robust national health insurance database, which would allow allocation of resources based on need. And Americans would actually see, for once and for all, the value of being united together to fight against a common enemy, a common disease, in this case, COVID, because we would have a coordinated national health insurance program that actually could give our way of tracking a pandemic and to give us the tools to figure out what works, what doesn't work. And the savings that we could have created from that would have been gone to protect the workers who are doing the hard work, like our nurses at the front line. And so I believe, and I'm pleased to see that PASNAP believes, that Medicare for all is the only rational solution for this country. And it's the reason why I think the more and more Americans understand what's wrong with our current system and why our current system is a total ripoff for the American people, why they will eventually get around to the point of understanding why Medicare for all has to be very close to the top of the national agenda for this country. All right. With that, I look forward to your comments and questions, and that's my email if you want to email me about that. So thank you for your time, and I'm happy to stop talking and hear any of your comments. So if there are any questions or comments you have, I know I'm a little early, right? So, but we have time for your questions or comments.
Walter, that total funding number that you gave, that's the total health economy, or is that just the government portion?
That's total health economy that includes hospitals, doctors, dentists, long-term care, nursing homes, pharmaceuticals, durable medical equipment, laboratory tests, everything. That's how much money we spend on healthcare in this country.
And about 40% of that starts out as tax dollars, correct?
Yes, at least 40% of that, and more than 40% of our, because we spend actually the majority of that money is from public funds. And the reason why is because we fund Medicare, Medicaid, the VA, TRICARE, plus all the subsidies we give to for corporations so they can deduct health insurance when they file their corporate taxes. If you add up all that money, something like 60 to 70%, 60, 65% of all our healthcare dollars are actually public dollars. Any other comments or questions?
So I would just say then that the healthcare policy of the United States is to funnel tax dollars to private companies without accountability.
Well, that's that's a good way of putting it. But most Americans don't think about it that way. Somehow or another, they think it's good to give money to Blue Cross Blue Shield and and the Kaisers and the, Geisingers and so on out in the world. Um, and they make tons of money off of this. And so uh, I mean, even though the nonprofit groups like the Blue Cross Blue Shields act just like the for-profits like Cigna, and Aetna, and so on. So uh, they actually have even a better deal because Blue Cross Blue Shield, basically, we don't charge them property taxes. We let them, we treat them as if they're nonprofits, even though they discriminate against people who don't have a health insurance.
Yeah, I mean, the thing, I think you touched on this, but one of the things that, the cost savings from having a comprehensive preventive care system could be really substantial, I mean, if you think about it, so many heart attacks and strokes are preventable through early intervention, and these tend to be kind of very, very expensive, time-consuming cases. So that's kind of on top of all the savings from the administrative cost reductions that would be redirected away from paper pushers and to caregivers at the bedside.
Absolutely. And, usually, people complain about labor costs. But if you think about it, uh, a- someone who's like a community health worker who serves as a liaison between the hospital and the home, or a health educator who goes out and teaches people not to, to stop smoking, or to, you know, get their colonoscopy or get their mammograms. Uh, yes, we pay them their salaries, but compared to the costs that we spend on high-tech equipment, and let's say surgery for breast cancer or the complications from a heart attack, I would much rather have paid that for that community health worker who could have been help educating people about what they can do to prevent illnesses. In the long run, for the healthcare system, it actually saves money for them because and it employs people. It gives people actually a very dignified, wonderful job, I think, to help teach people better health habits. And I think, we don't think that way. We don't actually invest in the community in healthcare, and that's a huge problem. In our high tech system, where we think the way we should take care of patients is to draw blood on them and poke them and stick needles in them all the time, and when a lot of this can come down to just good healthy habits. Anyway, you're talking to I'm someone who actually believes, in public health strongly.
On that note, like I've heard it said that with universal health care or Medicare for all, like one of the things that you would start to, that you see in a lot of places is that wage inequity or economic injustice is a healthcare crisis in and of itself. Like you have to look, because the emphasis is oftentimes more on preventative care, so that you can avoid like the healthcare costs of just of the expensive machinery and the heart attacks and everything. You're looking at more of, there are places where they look more at just economic inequality as a healthcare issue. I don't know if you can talk a little bit about that, or if that's true, or
Well, income inequality, I don't know if that's what you're referring to,
Yeah.
but income inequality is actually a huge problem. There's, I think there's a book which I'm blocking on. I think it's called like The Spirit Level, by uh, anyway, it's called The Spirit Level. It's this book, and it compares income inequality by different countries, and on almost any number of factors, not just health disparities, which we see in this country, but things like violence and civil unrest and mental health problems and so on. There's a large number of things where you can correlate dysfunction of a society related to income inequality. And so I think America is actually part of our dysfunction as a country is because we tolerate so much income inequality. There's almost this learned helplessness, like it's okay to have people where the top 0.1% make more money than the bottom 50% of the entire country. That's somehow another an acceptable way of thinking, and it's not. I mean, we have all kinds of strife in our society in part because of, I think, this huge income inequality. So, I mean, I could go on, but I think that you're right that this is a huge issue for us, and it's one of the reasons why we have these large health disparities that that plagues this country.
I figured a question with the Medicare for All program, will this affect some of the hospitals' prestiges? As you know, like Children's Hospital in Philadelphia being one of the top ones in the country versus AI DuPont in Delaware, who has not that national rank. If you had one payer mix with one set price, would it stop these bigger health systems with this prestige behind them that go about accepting patients through their insurance? Would that affect their ability to keep on top of the game, to say, or per se, for technology and stuff like that? And also, would it allow more people to go outside their networks to get healthcare, or would you be bounded to go to one health system, if you know what I mean? That makes sense.
Well, I think about this. What would happen to some of the hospitals that are PASNAP hospitals if we actually had a national health insurance system? Take Temple Hospital,
Good question.
where everyone who walked through the door could pay you, or Crozier Keystone, or Crozier Chester. I mean, would that help level the playing field in many ways? Because right now, you could argue that the private insurance elite people want to go to CHOP to get their kids treated. And I have nothing against CHOP. I think it's a great hospital. Okay. But I think St. Chris is a great hospital too. And I think it just happens to be in one of the poorest areas on Erie Avenue. And the disparity in our country of having the rich and poor get unequally reimbursed treatment, I think, is a national embarrassment. There's no reason why a Black kid in North Philadelphia going to St. Chris shouldn't get the top level of care as a white suburban privileged kid going to CHOP. And I think when you think about it more and more, there's no, we have, in a sense, medical apartheid in this country based on how we finance health insurance systems. And if you want to understand institutional racism, think about this, that fixing our healthcare system, our current healthcare system is the prototype of institutional racism. It is based on employment, and we know that employment in this country is racist in its origins, and that it's much more difficult for a Black person to get employed in this country than a white person. And if we base our health insurance system based on employment-based health insurance, which is what we do in this country, then we perpetuate the institutional racism that we have in our job market. And that institutional racism is an explanation of how difficult it is to fight institutional racism in America. Because a real test, if we could actually fight institutional racism, is Medicare for all. Medicare for all should be the battle cry for anyone who wants to fight against institutional racism, because it is a perfect example of how we can dispel the medical apartheid system that we have right now. And for your union members, the St. Chris, the Temples, the Crozier hospitals, all will be elevated tremendously. And you could make much better demands in your wage and benefit negotiations, I think, if they were better financed. I'll go on. I could go on, but this is a hot point for me.
Can I ask a follow-up to that, Walter?
Yeah.
Your last point. I mean, I get the point that, I think that's a compelling argument that places like, and I would add Einstein to that, not to mention small rural hospitals that are struggling to survive. These hospitals are full and they're struggling. I mean, Temple's doing okay now, but for years and decades, they were only surviving because they had like extra funding by the state. But the last point you made about shoot, I lost my train of thought. I was gonna follow up on that the last point that you made, which was what?
You mean about the institutional racism or the medical apartheid, or about the if all the hospitals could be paid
Oh, right.
on equal basis.
Okay. Yeah. You said that. So one question that might come up for nurses, you said that we'd be in a better position to bargain for salaries, but I mean, the counter to that is, Medicare and Medicaid are right now paying sort of subsistence payments to hospitals. Like, they figure out, here's how much they need to survive, here's how much we're going to pay. And if you look at other countries, doctors make substantially less. And so there would be a sort of built-in cap on potentially salaries and the ability to negotiate salaries. I'm not saying that's an argument against it. I'm just anticipating that just on that exact point that you made about our ability to negotiate, could it not also be a limitation if hospital reimbursements, they'd come to us and be like, hey, we're this is how much we're getting reimbursed by the federal government for your salary, basically. How
you would be negotiating with the hospitals themselves.
Right.
Hospitals would be paid under Medicare for all on a global budget.
Right.
So they actually know how much exactly they will have. And it's their global budget is based on generally their prior year's budget plus any changes in the populations that they're serving. Yes, there is a predictable amount, perhaps, that they could say, listen, this is our ceiling. We can't really go above that for our labor costs. But that's true. That would be true also for CHOP and HUP and all the other elites institutions out there. They would be on no better basis than you would at your hospitals. And I think that you would be being, I don't know what your nurses get paid compared to
Hello?
HUP and so on, but I think you would be, you can make an argument that you should be paid exactly the same as the other major teaching hospitals in the city. You know,
Well,
and
aren't doctors paid a lot less? You know, in countries that have,
actually, well, Canadian doctors get paid somewhere around $250,000 a year. I think they can live on that. You know, I mean, some specialists
do you know what
make a lot less.
do you know
Okay,
what nurse salaries are?
I don't know what Canadian nurse salaries are, but I don't see Canadian nurses migrating down to America for your salaries. So you can tell me if I'm wrong.
I mean,
That's
I do think that
that's
some
probably
of
true.
these are kind of the questions that kind of our members raise that kind of Mark is um, paraphrasing. But, you know, I think that it's also kind of a question of like, this is our country, you know, we can kind of structure our healthcare system the way that we want, you know, and if we want to kind of maintain high doctor salaries, you know, and kind of elite, flashy medical institutions like CHOP, or, you know, Penn for that matter, you know, that's our prerogative. And we're still going to have kind of substantially, you know, substantial savings overall because of, you know, even if we were funding hospitals, which are you know, a total racket with, you know, huge amounts of money going to people who don't, you know, do any productive activity, your CEOs and, you know, your revenue cycle, you know, vice presidents and whatever. You know, even just cutting out the insurance middleman, which is like and the pharmaceutical middlemen, you know, the profits, again, not even the researchers, that's still substantial savings overall to the current system. So it's really, you know, I think that, you know, part of how we frame it is, you know, there's not going to be, because kind of the system is structured by us, you know, by kind of we the people, you know, we can maintain the things that we like about this current system, the high wages for healthcare professionals, whether they're nurses or doctors or, you know, any of our other members, we can kind of maintain, you know, high levels of investment in pharmaceutical and medical research, while kind of eliminating the parts that we don't like, you know, insurance profiteering and kind of large overhead at the hospitals.
I mean, think about this. The average physician in America pays $84,000 more in administration costs and malpractice than they do in Canada.
That's crazy.
So even if Canadian doctors, you might argue, get paid the same or a little bit less than American doctors, their expenses are so much lower because they save that $84,000 in administration costs malpractice, that they actually are much better, much further ahead than American physicians. That $84,000 is wasted money in our healthcare system that the taxpayers and you as individuals are paying in premiums to subsidize that, which is going, you know, it's like you might as well just throw your money out the door.
Well, the big difference too that Sarah Nelson also brought up is, you know, we wouldn't be paying for healthcare, right? The healthcare is harder and harder every year to be bargaining for healthcare, and like that's
Yeah.
the area where I think we get hurt more than anything. And even the gains in salaries, you know,
Yeah.
are tempered by the constant increases in healthcare costs.
Right.
So it would solve, it would, that's a huge problem that, it's unclear how that's going to get fixed or solved, bargaining going forward.
It's not going to get solved using the current system. I
Right.
mean, we will bankrupt America perhaps before we consider fixing our healthcare system. And I think people should get wise about this. There's a reason why we're $25 trillion in debt, our national debt, because we have been borrowing money for the last 3 decades to prop up a system that is dysfunctional as our healthcare system. And I can go on and show you other slides that show you how our national debt is directly related to paying for an exorbitantly overpriced healthcare system, which, yes, we benefit from for those of us who work in the health profession. But I can tell you right now, it is not good for the economy. It means we have less money available for education. We have less money for any number of things that we value, and we don't pay for childcare. We don't support our kids when they're little. I mean, it's pathetic what we do. And then we want to know why gun violence is so bad, or why racial disparities are so bad. Or I mean, we don't make any investment to make to invest in people. I just think it's bad, you know. And we'll have less and less money in the future to fund education and social services and things that we know can help prevent illnesses in the future. The social determinants of health, if you will, decent housing, transportation, job opportunities, and so on. I should.
Okay, I'm in.
Okay, I think I'm on my bewitching hour, so you have to be sensitive to your time.
Can you hear me?
Yeah.
I have one question. How real is this conversation politically? We know that it can't change unless it's changed politically. And we also know that we're barely holding on to the Affordable Care Act. We
Yeah.
have a Supreme Court that's just dying for something to come up to them that's conservative, and they're just dying to have this conversation about the Affordable Care Act. And how real is this conversation? I know you said there's a bill, but how real are the people that can actually push this through, make this happen? How real is it?
Well, it's a fair question. Right now, there are no Republicans who support HR 1976. It would be a much stronger, something as important as healthcare if there was bipartisan support. But what I would argue is actually, if conservatives, if Republicans about it enough, they would insist on something for all also, because it's much better bang for their buck. They're not getting a very good deal out of our current system, as I showed you. We get to spend 4 more, die 2 to 4 years shorter. And I think that's not a good deal for the American people. And even a conservative person would insist that if I'm going to spend thousands of dollars in my taxpayer dollars for healthcare, for value for my money, and we're not getting it. And so I think increasingly the business community is realizing this, and that's why elections do matter. And I think that the more we can convince people to think about and educate ourselves about Medicare for all, the more likely it will become a reality. Right now, something like 70% of Democrats support Medicare for all. Something like 56% of the American people, including Republicans, and including 40% of Republicans, support Medicare for all. So it's not, I think the people are ahead of the politicians on this issue, surprisingly.
So I quick follow-up. How in the Democratic primary did they get away with framing this issue of like, even the Democrats, about like, where are you going to get the money? It's going to cost trillions and trillions of dollars. And like, that was the framing of it.
Yeah.
It's, you know, how is that, how is that possible? That nobody could like tackle that and answer that in a compelling way?
Well, they didn't want to say it out loud, but the answer is that you would eliminate the private insurance industry. And that's how you pay for, that's where you get trillions of dollars. Right now, they take $1 trillion out of out of the economy in health insurance premiums, and they do virtually, you don't need them. You could actually, the Medicare program pays doctors and hospitals directly. You don't need to go through another administrative middleman to pay doctors and hospitals. You could actually do it directly like the Medicare program does. So you have to ask
But
yourself.
let's be blunt. It's because the insurance companies pay the Democratic Party billions of dollars
That's
to
true.
not move this issue.
Yeah,
I mean, there's no mystery to it.
yeah. So that is true, Jerry, and I appreciate you point that out, that we have, campaign finance reform is actually a very vital part to fixing the system also.
Yeah, and just to kind of build off what Jerry said, it's actually interesting. A bunch of the anti-Medicare for all money has actually not been sourced to the insurance industry, but it's actually Tenet and CHS and the Hospital Corporation of America that have been kind of some of the biggest spenders against Medicare for all in particular. And that's, it's very interesting. That's just because of kind of an ancillary effect of Medicare for all is that they're, under this global budgeting system, there'd almost certainly be a crackdown on unnecessary electives that frequently leave people much less healthier than they were to begin with. So, a lot of your hip and knee kind of replacement surgeries, research has shown, it puts you at much higher risk for infection, and that, physical therapy in many cases would be a better option than, a large percentage of your hip and knee stuff. And, and so that would really undermine the bottom line of your tenants and your HCA.
Yeah, absolutely.
Yeah. Well, I agree. And, that's the other part I mentioned to you about healthcare is both financing and delivery. And we have allowed for-profit to take over both aspects, the financing through for-profit insurance companies and the delivery with for-profit hospitals like the Hospital Corporation of America and the CHSs and so on. You have the Prime, I think, is one of your employers, right? Your
Prime and Prospect and CHS.
Yeah. So I mean, you can tell me what it's like to negotiate the other side of the table with one of the for-profit entities.
So
They
do you
would be
think,
happy to get rid of you guys.
so do you think they would still survive, or you think they would be the for-profit hospitals chains would be going out of business?
I think they would go out of business. They'd have to become nonprofits.
Why?
Why?
Yeah.
Because the reason why people, why the hospitals like Chestnut Hill or Phoenixville would have to go to a for-profit basis in the first place is because they didn't have a reliable funding source.
Right.
But if they were on a global budget under a
They wouldn't
single
have
payer
to, yeah.
plan, they'd have a predictable source of income. They wouldn't have to worry about that.
But
They
would
know
it-
exactly a year in advance how much they're going to have to spend.
But wouldn't that also benefit the existing for-profits if they had a similar funding source? I mean, if you can survive as a nonprofit, wouldn't they be able to survive?
Yes, they could survive uh, and but the difference is that we would require probably under a single payer bill that they divest themselves from shareholder ownership, because we think the delivery system should only have one master, not two, where they have to provide patient care and they have to give shareholder returns. And I think they're in conflicts
Well,
fundamentally.
yeah.
It's hard, it's really hard to imagine what our healthcare system would look like under single payer. And it would be a long transition because so much of it has been completely warped
Yeah,
by the profit motive. I mean, the concentration of hospitals in big cities and the absolute absence of healthcare in vast stretches of rural areas. I mean, the changes in our infrastructure of healthcare would be dramatic, but I tend to think at the end of the day, there would be a lot less of it because so much of what happens in hospitals now is simply things that hospitals have promoted because they're reliable profit lines
yeah,
and not because they're medically necessary.
exactly right.
So, seeing what the new system would look like, we're not going to be able to see it until we get there. But if we focus, as you said, Walter, on it being a public good and a human right, then we have a framework to make the argument. And I agree with you. Political identification between Republican and Democrat is not the key. The key is that both parties are under the sway of all of the money that these companies have gotten from our taxes in order to fight us.
That's exactly right. On the Affordable Care Act, this one bill, they spent $1.1 billion to lobby for this one bill, the Affordable Care Act. That's how much money is on the line. When you think about it, you're talking about $51 trillion over the next decade. It was chump change for them to spend $1 billion to influence the outcome of the Affordable Care Act. That's the kind of money that we've given these for-profit entrepreneurs that have, in my mind, ripped off our healthcare system and destroyed it from what it should be, which is, it's not a business. It's actually a caring profession, which is what it should be. And I think if nurses don't stand up for that, who will?
All right, any
Okay.
other questions? Walter, we went over our time a little bit.
Yeah, I'm sorry.
No, it's fine. It was a great conversation. Any other questions for him before we let him go?
Thank you, Walter.
Thank you,
Thanks,
guys.
Walter.
Thank you
Good to
so
see
much
you.
for all your time. Everyone have a safe night.
Appreciate it, Walter.
Okay.
Thanks, Rich.